Good afternoon, everyone. Welcome to the webinar on the Population Assessments of Tobacco and Health PATH Study, Understanding the Data. I am Robert Choate, and I am the Data Processing Supervisor here at NIDA. And I'll let Dr. Hyland introduce himself as well.
Oh, sure, Andy Hyland. I'm the scientific principal investigator for the PATH study.
So here is our brief agenda for today. Dr. Hyland is going to give the background of the study and some of the findings of the PATH study so far. And then I'm going to come back and discuss finding and accessing the data, the future data collections of the PATH study, and then we'll wrap up with our contacts and allow time for questions. So I am going to turn the time over now to Dr. Hyland.
Okay, great. Thanks, Robert. The primary purpose here is the Wave 1 data from the PATH study are available through NIDA on a restricted use data file. And the purpose of this webinar is to give people a better understanding of how one would go and access that data and how they would actually use it. So it's a dissemination tool. I'll give you a brief overview about the PATH study for those that may not be that familiar with it. I won't get into lots of details about results. It's more to lay out the framework for what the study is, and then again the purpose is really to move toward trying to give people the tools to access the data. Let's see if we can just give me a moment here. Okay. The PATH study, really a little background on that. In 2009, the Center for Tobacco Products was created within the FDA with a law that set up the Family Smoking Prevention Tobacco Control Act. With resources that were appropriated from that law, they were allocated for the PATH study. In 2011, the initial contract was started, and again the goal here is really to monitor and assess tobacco use, its determinants, and its impacts in order to help inform this new regulatory authority that the Center for Tobacco Products has. The PATH study is a nationally representative longitudinal study, again funded by the Center for Tobacco Products within the FDA. It is administered by NIDA, so with an interagency agreement, and the study itself is developed both by FDA and NIH with assistance from Westat. Westat holds the prime contract to carry out the data collection, and you'll see Dave Macklin is the project director, and also with assistance from myself as scientific lead at Roswell Park, but also several other academic partners that we have that have helped design some of the core content and have been resources for the study design going forward. Again, it's a longitudinal design. This fills an area that is with our existing national surveillance systems for tobacco. Most of them are repeated cross sections. So the ability to look at change within an individual over time is something that those other surveillance systems aren't able to address. But in the PATH study, with the prospective design, we can look at changes in tobacco product use, harm perceptions, changes in health conditions over time, really wave to wave overall, and in different subgroups. So the longitudinal aspect is really one of the key distinguishing features of the PATH study. Just trying to work. There's a little bit of lag here with the presentation, but on to the next slide. There are some overarching objectives of the PATH study. Again, with the longitudinal design, we can look at between person, but also within person changes of things like, tobacco use patterns, harm perceptions, health effects. We can look at these things not only overall, but by tobacco use status or other subgroups such as race, ethnicity, age, gender, physical or mental comorbidities, and so on. Lots of opportunity to look at subgroups within the data that are there. The longitudinal design will allow us to get a better picture of the natural history of tobacco use, initiation, dependence, cessation, relapse, in particular in today's current marketplace where there's many different tobacco products. The PATH study will allow for a better understanding of these constructs. With regard to whatever regulatory thinking or actions that the Center for Tobacco Products may do, the PATH study is really anchored around trying to provide information to help support that mission. And lastly, the PATH study can also be used as a basis for screening participants for other small-scale research studies. These are being done to a certain extent within the contract itself. Some design features I mentioned already. A longitudinal design, it's nationally representative, household survey, U.S. civilian non-institutionalized population, age 12 years and older. All total, there's nearly 46,000 people in the wave 1 of the PATH study, with about 32,000 adults 18 and older and 13,600 youth ages 12 to 17. The wave 1 data collection took place from September 2013 to the end of 2014. There is a 4-stage stratified probability design. The bottom line is when we go and screen households, up to 2 adults are potentially sampled. There's oversampling, a significant oversample for young adults and for tobacco users. There's a slight oversample of African Americans as a proxy for menthol tobacco use. And then within those same households, up to 2 youth ages 12 to 17 are also eligible to be invited to participate in the PATH study. The weighted response rate for the household screener was 54%, and then among those households that are screened, about 74% of adults and 78% of the youth completed the full extended interview. The Wave 1 questionnaire and biospecimen collection, there's a number of instruments that are used in the PATH study. There's a screener, which we mentioned. There's extended interviews for both the adult and youth. The adult survey takes about 60 minutes. The youth is just over 30 minutes. Parents of youth that are included in the sample also complete a relatively short questionnaire to help complement some of the information obtained directly from the participant. The primary extended interview is done with audio computer assisted self-interviewing. Basically, a laptop with headphones is provided to the participant, and they walk through the interview with their own privacy with the headphones on. They can either choose to read the questions as they come up on the screen or have to listen to the questions being read to them. There are other types of instruments that are administered for different reasons throughout the PATH study, which include computer-assisted personal interviewing. We even have some paper and pencil kinds of data collection tools for specific types of tasks. With regard to biospecimens, again, another distinguishing feature of the PATH study. In Wave 1, all adults were asked to provide a blood and urine sample, and a portion of adults over a certain time frame are also asked to provide buccal cells, which are like cheek scrapings. Youth at Wave 1 were not asked to provide biospecimens at that time. So for adults, really blood and urine, there's the data that are collected. There are 4 broad domains of items in the PATH study questionnaires. Tobacco use, a lot of time and space in the instrument is devoted to trying to characterize just what products people are using and their patterns of use. Health, there are a number of questions that assess health conditions. Again, the FDA and the regulatory authority are trying to advance and minimize population harm from tobacco products. So understanding health impacts is very important, and there's both questionnaire items as well as biomarkers of both tobacco exposure and harm that are available in the PATH study. Two other broad domains are regulatory domains. Within FDA's purview are things such as tobacco product standards or health warnings, new and modified tobacco products. So there are items within the questionnaire that address some of these specific items of regulatory interest, and then sort of gluing all this together are various mediators and moderators, demographics, knowledge, attitudes, beliefs, comorbidities, which are used to help better understand potential relationships with some of these other measures. And again, think about longitudinal design. This is wave 1, where the restricted use file is available. I think at the end of the webinar there'll be a time frame, or in here there'll be a timeline that gives the broader picture. Currently, Westat has been contracted to complete 7 waves of data collection spanning out into 2024. I believe the current contract to do this data collection. And so you can imagine looking at changes in tobacco use and other health outcomes overall and in different groups over time. We'll have a real nice ability to do that. I think another distinguishing feature of the PATH study is the depth and breadth that it goes to assess what tobacco products people are using. And with the ACASI format, we use some of the technology available to us through the computer screen to be able to show images and couple that with text to really try to differentiate. The PATH study in wave 1 asked about 12 different types of tobacco products, and including, for example, as we get into some of the cigar area, there's interest in trying to differentiate the different types of cigars. There's traditional cigars, but there are also cigarillos and filtered cigars, which have they're similar in many ways, and in past studies have typically combined them together, but they are different in ways that are important from a policy or regulatory standpoint. So as an example, the past study uses images to complement the product descriptions, the words that go on the screen, in order to best help participants identify specific subtypes of products that they may be using. So for example, these are adaptations of screenshots from the wave 1, but you can see here, in order to try to identify users of traditional cigars, there is some descriptive text along with images that are artistically enhanced in order to show particular distinguishing design features. And the next slide here really shows this with cigarillos and filtered cigars, which look very similar in many ways, but there are some distinguishing features such as the filter tip on the cigarillos. Again, these images coupled with some of the text allows us to better differentiate what products people are using, so we can get the most accurate and complete information. That's just a little taste, a little timeline from where we are. Again, the contract was started in 2011. Wave 1 was completed at the end of 2013, and in that time since then, the data have been cleaned, weighted, documentation provided, and since January, the Wave 1 questionnaire data are available on a restricted use data file, which is why we're having this webinar here. Wave 2 data are actually complete. We're in the middle of Wave 3 data collection. In the subsequent time period, the Wave 2 data will also be fully documented, clean, documented, and also made available as a restricted use file. And over time, as more waves of data are available, the data will be available through the data archive here. You can see that the first 4 waves of data are at 12-month intervals, and then waves 5 through 7, there are 24-month intervals in between. In terms of next steps, The Wave 1 instruments and codebooks are available through the archive, and public use data files will be available later this year. And I think as we go on to the next slide, Robert is going to talk with us more about the nuts and bolts of how one actually gets at that information and can begin to use this fantastic resource that we have. Let's see, Robert. Do you need to take back control, Robert?
Okay. All right, so, and I am Robert with NIDA. And this is the homepage for the National Addiction and HIV Data Archive Program. NADAP is one of the topical archives at the Inter-University Consortium for Political and Social Research, ICPSR. NADAP's mission is to facilitate sharing of addiction and HIV research data. The archive began in the fall of 2009 and is funded by the National Institute on Drug Abuse. NADAP not only provides data for secondary analysis, but also technical assistance to data providers and users. So how to find the PATH study? This search box is available on every page on the NADAP website. Searching by the short title, PATH study, or the study number, 36231, or a unique funding agency, in this case NIDA FDA, is a good way to get the desired result at the top of your search results. So in this example, I typed in PATH study. Now, I changed that up for this example to, I used the search term NIDA FDA. Since the FDA is only affiliated with the PATH study in the NADAP archive, the PATH study came up as the top selection in our search results because our results are sorted by relevance. If you use the search term PATH study or the study number, the study will also come up as the top most relevant choice. If you search using a keyword, such as a type of tobacco, the PATH study will still come up in the list, but it may not be the first. You may then want to use some of the other sort options, such as sort by time period, or sort by released, updated, or sort by title. You can also use the facets on the left-hand side of the screen to help narrow your search results. Once we have selected the link there for the PATH study, that will take us to the study homepage. We strongly encourage users to thoroughly read all of the available information on the study homepage. Each study homepage NADAP archive will have the same general format. Some studies have more information in some of these sections, such as collection notes, sampling, or variable description. The PATH study is one of these studies. It has a very comprehensive study description. You may use the links on the left-hand side to navigate up and down the page between the various sections. The next thing to do after reading through the study description on the home page is to download and read the documentation files that are available publicly. These files are going to be valuable resources as you learn about the study and the data collection efforts, and as you work on developing your research project and put that project into a description as you submit your application for the restricted data. In addition to a code book and a questionnaire for the adults and for the youth files, there are 4 study level documents that pertain to the entire study. And these are informed consent documents, non-response analysis, a master tobacco product guide, which is in Excel, and a user guide. We encourage you to use the questionnaire and code book side by side to gain a fuller understanding of how questions were asked. The code books also contain important notes that will help users understand how variables are displayed in the code book. And the questionnaires contain additional information at the beginning of the document that describes how variables were displayed, asked, and the flow of questions based upon prior responses. Now let's talk about how to find specific variables in the study. Previously, we discussed the search box that will allow users to search for a study. A second search feature allows users to search individual variables and then to compare the variables that they find. So there are two ways to do that. From the top ribbon across the screen, you can click on Find Variables, and that will allow you to search variables across all of the studies that NADAP has in its archive. Or if you are on a study homepage, such as the PATH study, and you go down to the bottom of the study description, you will see a variables section. From this section, you can list all of the variables available in the study, or you can search for individual variables within this study only. So let's do an example here. So on the previous page, I typed in e-cigarette as my search term, and that brought up these search results. If I was only interested in looking at variables about e-cigarettes in the adult file, I could use the filter on the left-hand side of the screen to narrow my results. But in this case, I had two variables that I wanted to compare show up right at the top, so I selected those two variables because they were similar between the adult and the youth file. So I'll show you now what the comparison feature looks like. Once we select our variables and hit the Compare button, we are brought to this screen where we can see the variables side by side. Users may select more variables to compare, but the display becomes narrower, or it will put the variables in a list to compare up and down instead of side by side. In this example, we can see that the variables are named the same and have the same variable label, basic variable label, and the response categories are also the same. But the actual wording of the question is the same, but there is a lot more information associated with the question from the adult file than with the youth. And that's one reason why we encourage you to look at the code books and the questionnaires together as you go through the data. One last feature we wanted to point out prior to getting into accessing the data is the related publications section of the study homepage. Here you can find publications where authors have used the data and then cited it in their publication. Once your document is published, or your manuscript or journal article that used the data from a study obtained from NADAP, we ask that you email ICPSR with your citation. It is a win-win when you publish and provide us with the citation. So these citations will be important to use as you are learning about the PATH study to see what work has already been done. And then you can also add to our database by providing us with your citations after you have published your research findings. So now let's talk about how to access the PATH study data sets. So as Andy mentioned, the questionnaire data from the Wave 1 restricted use file is now available. This study was originally released in December of 2015. Preliminary codebooks were released in January of 2016, and just last month we had a major update where we released fully documented and comprehensive codebooks and some additional study documentation. The restricted use file is available to qualified researchers who complete an online application and are granted access to the data through ICPSR's Virtual Data Enclave, the VDE. We provide data to the qualified researcher in SAS, SPSS, Stata, R, or tab delimited or ASCII files. So in the future, the questionnaire data will be available for Wave 2 early next year as a restricted use file, and as Andy already pointed out in the timeline. And we anticipate the public use file for Wave 1 to be released sometime later this summer. The public use file will be downloadable, and you will be able to access that file in any of these statistical packages that I just mentioned. So how to apply for access to the PATH study restricted use file? There are 4 basic steps. Read the PATH study documentation, read the restrictions note under access notes in the study description, consult the VDE guide, and then apply online using the link in the access notes. Let's look at each of these steps individually. Again, we cannot emphasize enough the importance of reading the available documentation. You'll be able to understand who are in the samples, what types of tobacco products were asked about, understand how the data was collected. You'll be able to help find the variables that you need for your project and confirm that sufficient cases are available for your research questions. After you have read the available documentation, we invite you to look at the access notes, which is just listed right above the documentation. If you click on the link for restrictions note, it will bring up it will expand and bring up the bottom 2 paragraphs. Well, there is a link in that bottom paragraph for a VDE guide, which will take you to this page. And in addition to each section, there are links to frequently asked questions to assist your understanding. Reading this guide will help you avoid some of the hassles that might come up as you go through the application process. So you can go through this guide as a series of web pages, or you may download it as a PDF document. Once you are ready to start your application, you would click on the link Apply Online for access to the data under the Access Notes section, and that will bring you to this page. It provides a broad overview of the 3 main steps that will occur. The VDE guide is also available from this page to assist you. Through this process, you will be in contact via email with NADAP staff and ICPSR's computer network team. There is no fee to apply or use the restricted PATH study data. So once you're ready, you would click on Start a New Project, and that will bring up this page. So we'll talk about how to complete an application. This page can be filled out by someone other than the primary investigator. Please use the name and contact info of the person who will be serving as the lead researcher. The project description will allow up to 3,800 characters. The project description should contain the reasons why the restricted PATH study data is needed and which parts you need for your research. For example, are you only interested in data on youth to answer your research question, or do you need data on both adults and youth? The project description should also include a brief summary of the investigator's experience using confidential data. A short listing of relevant publications is also good to include here. If the primary investigator is someone without a PhD, then the project will need a sponsor. That sponsor's information should be included in the project description. After you've filled out this page and submitted it, you will, your application will be assigned a project number. You will be emailed a restricted data use agreement. You would then work to review that agreement, complete it, and sign it. The signed restricted data use agreement would be signed by the principal investigator and a representative of your institution or organization with the authority to enter into agreements on behalf of the institution or organization. Two other documents are also needed for submission: an IRB approval or exemption, and if you are with an organization that does not have an IRB, we can refer you to resources where you can obtain this. And the third thing is a CV, a resume, or an NIH biosketch for each team member. A research team may have up to 10 members on it. There are a limited number of virtual machines available for the PATH study. So we ask that not all individuals are logged in to the VDE at the same time, so as to not allow other individuals on other projects access. Once these three types of documents are emailed to NADAP via the email address that is listed here, NADAP staff will work with you to approve the request or to help you make modifications. Once all of your documentation is submitted and complete, your project will be approved, and you will receive email communication, where you can then go back to your application and assign VDE users to obtain licenses for VDE access. So that is basically the process for applying for the restricted use data. NADAP staff is here to help you as you go through the process. As we look forward to the summer, again, previously mentioned, the public use file for Wave 1 will be available, and we'll offer that in the full suite of ICPSR statistical packages that ICPSR prepares for users. There will also be potential for online analysis options. The public use files will be set up in the same fashion as the restricted use files. From the study homepage, users will see a lot of similar information and be able to access the same types of documentation files. They'll be able to download the data into a statistical program of your choice. NADAP is still coordinating with the NIDA and the FDA on exactly which of the online analysis options might be available. NADAP, NIDA, and the FDA will be excited to announce the release of the public use files later this summer. We're near the end of our presentation. We will not take the time to show this video, but the video linked on this slide is just one of many videos that NADAP has done over the past few years. Videos are available from prior webinars and ICPSR data fairs on other studies archived by NADAP and other general topics. These videos are listed on the Trainings tab of the NADAP website. Today's webinar will be available from this training page in a couple of weeks. All videos linked to ICPSR's YouTube channel. The PowerPoint slides of the presentation will also be available from that YouTube page. So where is the best place to stay up to date on the most recent happenings about the PATH study and all things related to NADAP? Then we invite you to join us on social media. Anything PATH related will definitely be going up on Facebook and Twitter right away as they happen. Just the other day, we posted about the upcoming ICPSR Summer Program Workshop that is taking place the first week of August. So come find out more about this free 3-day workshop on the PATH study. We only post 2 times a week, so it won't take too much of your news feed. And we have a lot of varied content, so there's always something new that is going on with us. So please like us, follow us, and engage with us via social media. If you have questions on finding the data, applying for the data, or general questions about the PATH study or about NADAP, please contact us at nadap@icpsr.umich.edu. And for more information about the PATH study, please visit their website at www.pathstudyinfo.nih.gov. that is the end of our presentation, and we'll now open up the discussion of any questions.
And Robert, it looks like we don't have any questions coming in yet. We'll wait. Oh, here we go. Just as I speak, of course, it comes on in. So you'll see one coming in here.
All right, so the question is, what is the rationale behind the requirement that a PhD degree is required for a principal investigator? Andy, do you want to field that? Or?
Well, I think this is generally consistent with NIH grants in terms of trying to identify as a screen tool for those that would typically be in the research community and performing independent research. Robert, if I recall, you indicated there are workarounds for that if one does not have that credential that they can be sponsored. Is that correct?
Yes, so we have many students who are master's students or PhD candidates who apply for the PATH study or other restricted data, and they work with the faculty sponsor who will sign the agreement, because these restricted data use agreements need to be signed by someone with the institution that has authority, and a student does not have that authority. Our next question is, does the data set include SES types of variables?
This is Andy. The answer is yes. There's many questions in general, but there are items on one would be more traditional SES kinds of measures. I strongly encourage people that might be interested in not only this construct, but really any construct, to go and take a few minutes and review the instruments to see just exactly what's in there. There's lots and lots of questions that are in there, but SES is an important construct. It's a key correlate of tobacco use, so you should find measures of that within the questionnaire.
So you should be able to use the variable search option on the PATH study homepage to find those variables, or do a search in the PDF documents are also searchable. So the next question is, what general types of variables distinguish the restricted use file and the public use file?
And Robert, maybe you're probably best positioned to talk about that.
To be determined.
That is still to be determined. WestStat, NIDA, and the FDA are working together to determine exactly what is going to be going into the public use file later this year.
Yes, I agree. I think the broad distinguishing feature is that the public use file is scrubbed, for lack of a better term, of measures that have the potential to be able to identify participants. So certainly within the restricted use file, we're not listing addresses or things like that, but there are the data are a little bit more sensitive. The public use file goes a step or two further to really look at each measure and make a determination if this has the potential for disclosure risk or not. And we're currently in the process of doing that kind of review, and as Robert mentioned, later on in this calendar year, we expect the public use data file to be available.
And we are told that there will be documentation, there will be information in the documentation that will succinctly describe the differences between the restricted use files and the public use files. It should be very clear what is different between the two. Another question was to follow up on the earlier PhD requirement question. Many MDs do NIH-sponsored clinical research, but do not themselves have a PhD. Can they serve as a PI on a PATH study proposal?
It's actually a terminal degree, not a...
Yes. So the PhD, it's actually, the wording that is actually used is a terminal degree. So if you have a terminal degree, such as a medical degree, that would be sufficient. And if there are questions, please feel free to contact NADAP, and we can work with you and help you clearly identify what you need to do to apply for the data.
Yes, and I think the take-home point is that the goal is to be inclusive and to try to facilitate responsible use of the available data. So I think, broadly speaking, that as much utilization of it, the better. That's the whole point of the investment that has been made in the PATH study. So yeah, I think what Robert's saying is that if you have a question, when you get into the process, work with the staff, and hopefully a solution can get worked out.
And one follow-up question about this is, a master's degree considered a terminal degree? And the answer is no. Or for
right. I think, and that, Robert, that might be a case where there might be a conversation that's had different disciplines are different. I think the comment specific to the librarian degree, where the standard may be different. So again, I think that the goal is to be inclusive and to try to promote the utilization of the data, but to do so within a framework that has some rules and expectations, and so hopefully the guidance that's given captures most of the instances. But again, if there's something that falls through the cracks, I think that's where the staff are available to try to develop a solution that will work.
I think that's very well said, Andy. Thank you. Are there any other questions that would like to be asked at this time? We still have a few more minutes of time available. And if you do have questions that you think of later, you can feel free to email NADAP at the nadap@icpsr.umich.edu, and we'd be happy to help answer those questions. I don't see any more questions coming in, so we do thank you, everyone, today for your time and listening to Dr. Hyland and myself discuss the PATH study, what it is about, and how to access it. And we hope that you will come to the NADAP website and learn more and apply for the data. Thank you again for coming today.
Okay.